I'm joined by Dr. Tom Frieden. He's the director of the Centers for Disease Control. He did a telebriefing on this very issue just yesterday. And I want to ask you, Dr. Frieden, thanks for joining us. I want to ask specifically about this medical evacuation to start. We know a plane left around 5 o'clock Eastern time yesterday on the way to Liberia to try and bring back these 2 American healthcare workers who have been infected with Ebola. We understand the State Department oversees this sort of thing, but I'm curious as to who approved this, who looked at the risk-benefit analysis and approved this sort of medical evacuation.
The decision is really that of the organization that put the individual there. So Samaritan's Purse, the organization that was providing care for Ebola patients in Liberia, made the decision to arrange for the medical evacuation. The individual is an American citizen, so he's repatriating with the disease. Our role at CDC is to make sure that in the transportation and in the care, any risk of infection to others is kept to the absolute minimum. And it's important to understand that you don't need a fancy special isolation facility for Ebola. Ebola is a deadly disease, but we know how to stop it, and we know how to prevent it from spreading.
Yeah, and given the concern about Ebola, also given the fact that this strain of Ebola has not been in the Western Hemisphere, let alone the United States, could you have said no? This is not something that you would authorize in your position as director of the CDC.
We do have the authority to quarantine and isolate people. Exactly whether it could be applied in this situation we would have to look at, but we don't think that arose because the way Samaritan's Purse arranged it, we did not feel there was a risk of bringing the person in or hospitalizing them here. And you know, in the past decade, we've had 5 people in the U.S. who came in and ended up having not Ebola, but a related hemorrhagic fever, either what's called Lassa fever or Marburg virus. And in all of those cases, they were cared for in hospitals, and there were no secondary infections, no spread.
When you think about getting care in the United States versus Monrovia, it seems like several options could have come up. I mean, they're getting the care that they're getting now. You could have bolstered up the care that they're getting in Liberia by flying in supplies or services or expertise, or they could have made the decision to come to the United States. I mean, how do you weigh the risks, benefits of those various options?
Well, one thing we've traditionally said is that if someone has Ebola, the risk of medical evacuation may well outweigh the benefits of a higher level of medical care. Medical evacuation is arduous. A flight over the ocean is arduous, and someone who's got Ebola may have delicate arteries and veins, and that may lead to bleeding complications, so the travel itself may be harmful. And the idea that you can provide more care, you have to understand that for Ebola, really the care is supportive, making sure people have fluids, giving blood transfusions, oxygen if needed. So it's not as if we have a big difference in what we can provide here versus other places. But that decision was made by Samaritan's Purse. It's an American citizen. He's fighting for his life, and we want to support them in their decision.
So just to be clear, it sounds like there's nothing in particular that's going to be new or really different that they're going to get in the United States versus where they are. If there were specific things that they needed, it could have been flown there. This was purely because they wanted to bring these patients home to the United States. Is that right? Is that what drove this?
You'd really have to ask them. It was their decision. But we're here to support the decision and to remember that I know that it creates fear in people, but I really hope that people's fear won't outweigh their compassion. We've got a real challenge in West Africa, and what we have to focus on is stopping the outbreak there. We will be able to stop it, but it's going to take supporting people, and that means that if people who are working on that response get sick, we care for them.
You know, one of the things, Dr. Frieden, that comes up, and you've been transparent about, is lapses at the CDC recently. And there are lapses in hospitals as well with regard to infectious disease protocol from time to time. Even in very good hospitals, as you know, there is a human element to this. So even with the best sort of intentions, Dr. Frieden, what kind of assurances can you say for sure that, you know, with regard to this patient or these patients, that there won't be other infections, that these patients won't somehow infect a healthcare worker or somebody else within the hospital?
Ebola is a virus that can be stopped. It can be stopped in the community by control measures, and it can be prevented from spread in hospitals by meticulous infection control. That means you really have to follow every one of the procedures carefully. Doctors Without Borders, MSF, has been caring for Ebola patients for many years in outbreaks. They've never had a death in one of their workers. So and that's in work in Africa without the kind of advanced infection control procedures we have here. The stakes are higher with Ebola, but the risk is no higher. It's a virus that's easily inactivated with standard cleaning solutions in a hospital. I think we fear it because it's so unfamiliar, but we shouldn't let that unfamiliarity trump our reason about the possibility, the likelihood, the availability of effective infection control in hospitals throughout the U.S. Ebola is a huge risk in Africa. It's not going to be a huge risk in the U.S.
Yeah, and again, you know, it's clear that the resources are more readily available in the United States. They're better, but that human element, again, you're knowingly bringing a patient with Ebola into the United States, a virus that has not been here. And if there is some sort of lapse in the human element of precautions, I mean, how do you tell your neighbors? You live here in Atlanta. How do you tell your neighbors and frankly people in the United States that we are 100% confident this isn't going to turn into something more, even if it isn't a mass outbreak? How can you tell people to be 100% confident that someone else won't die or get sick as a result of this decision?
Ebola does not spread by casual contact, and it doesn't spread by somebody who's not ill. It spreads when people get sicker and sicker and sicker. The amount of virus in their body increases, and so the risk in Africa is the healthcare workers who are caring for them and in the burial process. Those are the two things that are driving the outbreaks in Africa, and we can prevent those risks from happening here.
The doctors at Emory, you know, they're the ones who are going to be caring for the patient or patients. Did you have conversations with them about this? Was there any hesitation? Again, I understand that, you know, infectious disease protocols are well known, well documented, and implemented oftentimes very effectively. But we are talking about something that has not been cared for in this hemisphere of the world, this country certainly. Tell me how those conversations took place, and were there any reservations about this?
We have an ongoing relationship with Emory. We're, as you know, quite near to them. And one of the things we'll be doing is helping them and supporting them as if the patient does arrive, as they care for him.
When you have several hundreds of people now leaving West Africa, coming back, you know, the Peace Corps volunteers are voluntarily leaving West Africa. You have many other organizations that are now bringing their folks back. How do we ensure that they are not unwittingly bringing the Ebola virus in? There is an incubation period between exposure to getting sick. They may not even know that they have been exposed to it, and they could be on planes heading to the United States or other places around the world. What sort of safeguards do we have in place for that?
So, as you know, there are 2 Peace Corps volunteers who may have been exposed to Ebola, and they are under observation. What we do with contacts is ensure that their temperature is monitored every day for 21 days. That's the longest period of time someone has ever seen between exposure and illness. If someone begins to get sick, then they're rapidly isolated and tested so they don't continue another chain of transmission. Ebola doesn't spread from someone who's not sick. It doesn't spread by casual contact.
I'm always amazed, you know, the doctors, and you and I are both physicians, but it's remarkable work to risk your own health to care for somebody else. The people who are aboard that plane and going to bring back these passengers or passenger, you know, they're at some risk from this, but also simply getting the passengers then from the airport to the hospital. There are various steps in all this. How is that going to take place? Once the plane lands, how are they going to get the patient to the hospital?
I'm not going to go through the details with you, but fundamentally what we'll ensure is that there is no risk of spread during the transportation process, and then we'll be supporting Emory in their isolating the patient.
I mean, the reason I ask if they're going by ground or by air, just trying to give people a little bit of a sense, because there's so much concern here in Atlanta. And I think the people are better understanding how unlikely it is for this virus to spread person to person. But still, how do you give assurances? These are your neighbors, your colleagues as well, just simply getting the patient into the isolation unit. There's going to be several steps there.
I think people do have misconceptions that somehow it may spill out or erupt, but I really hope that our fears, particularly our irrational fears, don't trump our compassion for someone who's fighting for his life.
Just finally, Dr. Frieden, lots of people, you issued a recommendation regarding travel yesterday that non-essential travelers not go to West Africa, these 3 countries in West Africa. What sort of screenings are taking place at airports to try and mitigate or reduce the number of people who may, again, unwittingly take Ebola around the world?
There are really 3 levels of defense to keep Ebola from spreading. The first and most important is to control it where it's spreading. If we don't do that, we're not going to be able to increase safety. That's the most important, source control, basically. Second is working with each of the 3 countries which have completely committed to working with us to ensure that people with Ebola or high-risk contacts don't leave. That's not easy because it requires them improving their response, identifying patients and contacts better, and screening at the airport. But we are undertaking that. In fact, we're sending teams to each of the 3 countries to help them improve those systems. And then third, understanding that even with the best of symptoms, it's possible that people come in and become ill. So we're informing and educating doctors in this country, how do you diagnose, how do you test for, how do you isolate patients who may have Ebola. Here at our lab at CDC, we will do the testing, and that's available, and that information is disseminated to doctors, healthcare systems, and others in the health system in the U.S.
And again, just finally, with regard to Dr. Brantley or Nancy Whitepall, you have no reservations about one or both of those patients coming back to the United States with the Ebola virus?
There are really 2 questions. One is, can they travel safely for their own health? And the second is, can we ensure that the risk of spread during transit and in care here is kept to an absolute minimum? And that's something that's very important to do, and we will work closely with Samaritan's Purse and with Emory to ensure that that is done.
Dr. Tom Frieden, Director of the CDC, thanks so much for joining us. Appreciate it.
Thank you, Sanjay.